Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to discuss about the excisional procedure, which is a treatment of choice for cervical intraepithelial neoplasia, right? So in the previous module, we discussed about the cryoablation, which was a minimally invasive procedure performed as a treatment of choice for cervical intraepithelial neoplasia type 1. Now in this module, we are going to deal about the LEEP or LLETZ, right? So before starting with that, what is the actual abbreviation of this LEEP? So LEEP stands for Loop Electrosurgical Excisional Procedure. Loop Electrosurgical Excisional Procedure. So here we have loop, we have electricity, and with the help of the loop and electricity, we are going to perform some excisional procedure, right? And what do you mean by LLETZ? So this LEEP is also known as LLETZ, the same procedure, but it has two abbreviations, that is LEEP and LLETZ. LLETZ stands for Large Loop Excision of the Transformation Zone. Now you tell me, what is the transformation zone? As we have studied in the previous module, transformation zone is that area of the cervix which lies between the old and the new squamocolumnar junction. Right, between the old and the new squamocolumnar junction, the area of the cervix, that is called as the transformation zone. We have three types of transformation zone: type 1, type 2 and type 3. Type 1, the transformation zone is entirely visible and it is located in the ectocervix. Type 2, the transformation zone is still entirely visible, but along with the ectocervix, the transformation zone has an endocervical component. And type 3 is where the transformation zone is not entirely visible, because we can see that the transformation zone is extending inside the endocervical canal. So that is all about the transformation zone. So here what I am going to do here is that with the help of electricity and with the help of an instrument such as a loop, we are going to do the excisional procedure, right? And while discussing about this LEEP, it is actually an OPD procedure. It doesn't require any admission, right? Admission is not required, no anesthesia is required, and it is an OPD procedure, and this procedure can be performed within 10 to 15 minutes. Okay, yes. So with the help of what this procedure is done? So this procedure is done with the help of a loop, with the help of a thin wire loop. As you can see in this image, this is the loop. So with the help of a thin wire loop, we are going to perform this procedure. So as we know, as we derive it from the term LEEP, loop electrosurgical excisional procedure. So we have loop and the electricity. So this procedure is going to require electricity, right? Okay. So what is the actual procedure? So the actual procedure is that the current is passed through the wire. So this is the wire which we can see here. So this is the loop, and the electricity is passed through this wire. So this wire is actually going to cut and coagulate at the same time, right? So electricity is going to be passed through this loop, and this loop is going to cut the abnormal cervical tissue which is being present in the cervix, and it is going to cut and it is going to seal, that is coagulate the tissue at the same time. So ideally you are going to introduce a loop, a thin wire loop, guided through a pulse speculum examination. You're going to introduce a thin wire loop and you're going to pass the electricity, and with the help of this thin wire loop, you're going to cut abnormal cervical tissue which is being present in the cervix, and not only it is going to just cut, it is going to cut and coagulate the tissue at the same time. So you cut the tissue and you seal the tissue, right? So whatever abnormal cervical tissue has been present there, you're going to cut and seal it, and you're going to remove that. Once you're going to remove that cervical tissue, you're going to send it for histopathological examination. So now you may have the doubt that what is the actual depth with this thin wire loop can actually remove. It can remove up to a depth of about 10 millimeter. So up to a depth of about 10 millimeter, this thin wire loop guided with electricity, it can remove the abnormal cervical tissue up to a depth of about 10 millimeter from the cervix. And after removing this, you are going to subject it for histopathological examination. Is that clear? So that is all about this LEEP. It is very simple, right? With the help of a loop, with the help of electricity, you're going to pass it, you're going to cut and coagulate it at the same time and subject it for histopathological examination. It is an OPD procedure. This procedure can be done within 10 to 15 minutes, right? And no admission is needed and no anesthesia is required for this procedure. But then we have some prerequisites. If the patient is taking some anticoagulants, aspirin tablets, you have to ask the patient to withhold those tablets 3 days prior to the procedure. Ideally 3 to 5 days before procedure, you have to advise the patient to withhold that. Why? Because is that since it is anticoagulant in nature, it may lead to increased bleeding while doing the procedure. Is that clear? Okay. And it is also advised to do this procedure shortly after the menstrual cycle. So if a female is having menstrual cycle now, you advise the female, please come to me after your menstrual cycle completes so that we can do this procedure. So after the menstrual cycle, and the patient has to withhold aspirin tablet, any anticoagulant if she is on. Right? So these are the prerequisites. Now, so what are the indications and contraindications of this procedure? So the indications is that we have cervical intraepithelial neoplasia type 1, type 2 and type 3. Type 1 corresponds to low-grade squamous intraepithelial lesion. Type 2 and 3 corresponds to high-grade squamous intraepithelial lesion. Report of the pap smear. So in CIN1, the treatment of choice was cryoablation if the criteria for cryoablation was met. But for 2 and 3, the treatment of choice stands to be LEEP or LLETZ. So if someone asks you what is the treatment of choice for loop electrosurgical excisional, what is the treatment of choice for cervical intraepithelial neoplasia type 2 and 3, the answer has to be loop electrosurgical excisional procedure or large loop excision of the transformation zone. Is that clear? Okay, so this is the one of the indication. So the treatment of choice for CIN 2 and 3 is LEEP or LLETZ. Okay, so let's say for example, you're going to do this procedure in a patient with CIN 2 or 3. So after doing this procedure, you have to ask the patient to come for a follow-up after some months. So once the patient comes to you for follow-up after few months, let's say for example 4 to 6 months, you are going to examine her. And while you start the screening in her, if you get to know that the cervical intraepithelial neoplasia is still persistent in her, irrespective of doing the procedure, then what you have to do? So in case if the cervical intraepithelial neoplasia is persistent even after the procedure and you get to know only during the follow-up after doing the procedure, you have to repeat this procedure for the second time. So let's say for example, I'll make it clear for you. A patient with CIN 2 came to me, right? So since it is a case of CIN 2, I'm going to do LEEP procedure in her, and I did the procedure. Now the patient is coming to me for follow-up after 6 months, and I'm going to do the screening for CA cervix in her, and during the screening procedure I get to know that the cervical intraepithelial neoplasia type 2 is still present. So if it is going to be present, now what you have to do? If it is present, you can repeat this LEEP procedure for the second time. So already you have done LEEP for the first time and now you can repeat it for the second time. Okay, so now you have done the procedure for the second time. Now the patient is coming for follow-up, and during the follow-up you are going to screen the patient, and during screening you came to know that the cervical intraepithelial neoplasia is still present. Now what can you do? So now what you can do is that since the cervical intraepithelial neoplasia is persistent in her, it is recurrent in her, irrespective of doing whatever excisional procedures, now you need to consider hysterectomy in this patient. Please remember that hysterectomy is never a treatment of choice for cervical intraepithelial neoplasia. But you need to consider this hysterectomy when doing, even after doing this excisional procedures for the second time, this disease is going to be recurrent or persistent in that female. Now you can consider hysterectomy in that patient if she comes under the appropriate age group category and she has completed her life. So what do you mean by here is that irrespective of any age and parity, you're going to do this procedure LEEP, right? So even after repeating this LEEP procedure for twice, if the disease is going to be recurrent or persistent in that female, now it is high time you need to consider hysterectomy in this patient, because if you are not going to do hysterectomy in this patient, sooner or later this cervical intraepithelial neoplasia can progress and it can become an invasive cancer also. So for that reason, if the disease is going to be persistent even after doing the excisional procedure for second time, you need to consider hysterectomy. So now you consider hysterectomy. But please remember, hysterectomy is never a treatment of choice for cervical intraepithelial neoplasia. Is that clear? Okay. The second indication is that while we were discussing about the cryoablation, I told you that, let's say for example, now a patient of cervical intraepithelial neoplasia type 1 came to you. And you know that any patient with cervical intraepithelial neoplasia type 1, which corresponds to low-grade squamous intraepithelial lesion, it has higher chances of spontaneous resolution or regression within the next 2 years. So you just want to reassure the patient and you ask the patient to come up for follow-up after 2 years. So even after 2 years, if the disease is going to be persistent, cervical intraepithelial neoplasia type 1 is persistent, now what you need to do, you have to consider cryoablation. So if the indications for cryoablations are met, I'm going to do cryoablation. If the indications are not met, I have to do the excisional procedure such as LEEP. But the treatment of choice for cervical intraepithelial neoplasia type 1 remains to be the cryoablation. So I have done cryoablation for the first time. Now the patient is coming for follow-up after a few months. Now I'm going to screen the patient. And while screening, I came to know that the cervical intraepithelial neoplasia type 1 is still persistent in that patient. Now, what you can do? Are you going to repeat this procedure? No, you should not repeat the cryoablation for the second time. For the second time, you need to consider the excisional procedure such as the LEEP, which is also known as LLETZ. So, previously failed procedures such as cryoablation, which has been done for the first time, in case of failure of that therapy, for the second time, you need to consider the excisional procedure such as the LEEP. So the second indication is previously failed procedure, that is cryoablation, which was done as a treatment of choice for CIN1. Is that clear? Okay. Now, we have dealt about the indications for this procedure. Now, what are the contraindications for this procedure? The contraindications are any infections, am I right? Pelvic inflammatory disease, cervical inflammation due to some infection, cervicitis, and if the patient is going to be pregnant, you can't do this procedure when the patient is pregnant. So the patient has to complete her pregnancy, and after she delivers her baby, she can opt for this procedure. So pregnancy is also a contraindication. Adenocarcinoma in situ is a contraindication. Invasive cancer is a contraindication, and any history of allergy to any anesthetic, let's say for example any local anesthetics or any iodine or any latex, if the patient has any history of allergy, you can't do this procedure as well. And after the procedure is done, you have to advise the patient to please avoid any vaginal cleaning, that is douching, insertion of any vaginal tampons, menstrual cups, or intercourse with her partner after the procedure for around ideally 4 to 6 months, right? Okay. Now, after you have done the procedure of loop electrosurgical excisional procedure or LLETZ, now after the procedure is done, you have to ask the patient to come for follow-up. So let's say the patient has come to you for follow-up after 3 months. So here you have to avoid insertion of avoid insertion of any tampons, vaginal douching, intercourse for a period of around 4 to 6 weeks. Right? It is 4 to 6 weeks after the procedure. So now the procedure is done, the patient is left home, and she is coming after 3 months for the follow-up, and she is coming after 3 months for the follow-up. Now I have to resume the screening for cancer cervix in her. So resume the screening for cancer cervix in her. Now, if the disease has resolved in her, it is well and good. But if it is not resolved and it is persistent, right? Let's say, for example, if the cervical intraepithelial neoplasia type 2 is persistent, now what I have told, you can repeat it for the second time. So repeat LEEP for the second time. Is that clear? Okay. So please remember one thing about the cervix and the investigations. Irrespective of whatever treatment options you do, after the treatment options, you have to have the patient in hold for screening for cancer cervix till the set age according to the guidelines which has been followed, right? WHO tells screening for cancer cervix has to be resumed for a period of about 30 to 49 years. So after 49 years, if the screening for cancer cervix comes to be negative for 2 consecutive samples, then you can stop the screening for cancer cervix in her, because the median age for cancer cervix in any patient or any female is 50 years. Is that clear? Okay. So now I want to tell a small difference between the cryoablation and the LEEP. The main important point is that you have an advantage with this LEEP, and the advantage is that since it is an excisional procedure and you are able to remove the abnormal cervical tissue up to a depth of about 10 millimeter, you are having a sample of tissue with you, and you can subject this tissue sample for histopathological examination and confirm. But in cases of cryoablation, where you're not left with any other sample, because in cryoablation you're not getting any sample, you're just going to cause crystallization of the intracellular water, right? It is going to just bring about the cryonecrosis, but you will not be getting any other sample which you can subject it for histopathological examination. So in cryoablation, no tissue sample is available for you for histopathological examination. But on the contrary, for LEEP, you have a tissue sample available with you, which you can confirm by histopathological examination. Is that clear? So this is all about the LEEP. As you can see here, right? So this is the loop, and you're going to insert this loop. As you can see here in the cervix, this is the area of dysplasia, and this wire loop is going to cut and coagulate at the same time, and it has removed. As you can see here, the abnormal cells have been removed. Now these abnormal cells can be subjected for histopathological examination. So this is one of the greatest advantage of this LEEP or LLETZ, since it is an excisional procedure. So this is all about the LEEP or LLETZ. So just a simple flow chart for you so that you might not forget, and also if you're going to have any exam soon, you can just have a small gist of this as a screenshot, so you can just go through this very rapidly and you can go to your exam. So let's please take a screenshot of this, whatever I'm showing you on the screen. So as you can see here, CIN1 corresponds to low-grade squamous intraepithelial lesion, and since it has the higher chances of spontaneous resolution, you're going to follow up the patient after 2 years. If it is resolved, it is okay, just resume the screening. If it is not resolved, you have to consider cryoablation. If the criteria is fulfilled, go for cryoablation, and after cryoablation, follow up after 2 years. If it is resolved, it is fine. If it is persistent, please don't repeat cryoablation, go for the excisional procedure such as LEEP. Right? If the criteria for cryoablation is not met, consider excisional procedure such as LEEP. For CIN2 and 3, since it corresponds to high-grade squamous intraepithelial lesion, the treatment of choice is going to be excisional procedure such as the LEEP or LLETZ. After doing the procedure, keep the patient and follow up. If the CIN is going to be persistent, now you have to repeat the LEEP for the second time, and then it is going to be recurrent for the third time also. Now you need to consider hysterectomy in that patient. The other excisional procedure which are available are the conization or the cone biopsy and the cryoablation. So 2 excisional procedure, that is the LEEP, LLETZ and the conization, and you can also have cryoablation as an option in CIN2 and 3. But definitely the treatment of choice for CIN1 is cryoablation, for CIN2 and 3 irrespective of the age and parity. So irrespective of age and parity, the treatment of choice for CIN2 and 3 is going to be LEEP or LLETZ. For CIN1, it is cryoablation. If the criteria for cryoablation is met, if criteria is not met, go for LEEP or LLETZ. But please remember, hysterectomy is not a treatment of choice for cervical intraepithelial neoplasia. Hysterectomy is only considered in a female if the cervical intraepithelial neoplasia type 2 and 3 is going to be persistent even after repeating the excisional procedure for the second time. So now that is going to be high time you need to consider hysterectomy in that patient. If you are going to fail to do hysterectomy, the patient can have evolved into a more advanced stage of the cancer where it can even become some invasive cancer of the cervix. Is that clear? So this was all about the excisional procedure LEEP or LLETZ. So I hope I have covered everything about the gynecological procedures, right? And based on the reports of the pap smear and the colposcopy, what are the treatment options which are available also we have discussed. There are 3 treatment options: cryoablation, LEEP or LLETZ, and conization. All the 3 has been discussed. So in the next module we'll be discussing about the WHO guidelines which has been given for screening of cancer cervix. Is that clear? Okay. See, I need to tell you one thing. Cervical intraepithelial neoplasia type 1 has the highest chances of spontaneous resolution, be it in the next 1 or 2 years. But for the cervical intraepithelial neoplasia type 1, in order to evolve and progress into the next stage, that is the cervical intraepithelial neoplasia type 2 and 3, it requires a longer duration of time. Nearly it will take around 5 to 7 or 5 to 10 years in order to in order to evolve into the next stage, that is the cervical intraepithelial neoplasia type 2 or type 3, right? Okay, so I hope I have included every important points which are important from your exam point of view. So I hope I have made the best out of me what I could give you. So in case if you have any doubt, please write to us in the Mackler Instagram handle or the Gmail. We will reach out to you as early as being possible. Thank you. Please do follow and subscribe to this Mackler handle so that you will be posted with the latest lecture modules which have been released in day to day.